Do shoulder impingement stretches even work? You have shoulder pain, someone has told you you have a shoulder impingement, and you have tried all the stretches in the world and still you have pain? Well, my name is Huang. I'm an occupational therapist and certified hand therapist. This video is going to be for you because if you've tried all the stretches and you still don't know, like, does this even work because I still have shoulder pain? Well, I'm going to share with you, it is not just the stretches. You have to strengthen with it. I'm going to share with you one of the things that I do with my patients so you could do it for yourself as well. And also go check out my last video because the direction of your stretch plays a role in how to get better. So if you're stretching in only one direction, you might be missing out on a particular direction that's really going to help you with getting rid of your shoulder impingement. So go check out that video before you check this one out. But stretches are nothing without strengthening, especially when it comes to shoulder impingement. Impingement just means your shoulder blade bone and your humeral bone, your arm bone here, they're hitting together. Usually they're hitting together because something is really tight and something is really weak. Going to a certified hand therapist or an occupational therapist, physical therapist who can help you figure out where you're tight is the key thing. Majority of the time people feel really tight back here. What we call their capsule is really tight. Like we have like a balloon. It's like a ligament. It is connective tissue. And if you can imagine, it's like a balloon that holds this bone and this bone together, right? So that capsule can become really, really tight, but it's really the muscles that are weak. So you can have two different types of problems, which causes these two bones to keep hitting into each other, right? So stretches in certain directions can really help to loosen the capsule, but then you have to follow it up with strengthening. Stretching without strengthening is absolutely nothing. It's garbage. Well, it's not really garbage, but you're just not going to get the results that you're hoping for. So one of the things that I really love doing is making sure that we strengthen the muscles, not just stretch it. So if you saw my last video, I did a lot of stretches into shoulder extension. So there's two ways to then strengthen it to follow up so that you can make sure that the muscles that you're moving of the scapula of the shoulder blade actually continues to keep helping you. Let's go to the mat and let's check it out. Get on the floor, get on your bed, get on a mat. I don't care where you do it as long as you do it, right? So the muscles in the back, when you lay down, you're working those muscles against gravity. So you're gonna lay down and you're going to have your palms up. You see my palms are up, and then we're gonna lift up and then down, right? When you lift up your arms, you have to squeeze your shoulder blades together. You're gonna lift up and then down. Lift up and then down, right? 2 sets of 10. And that's called shoulder extension. And that really can help you to move your shoulder blade, help strengthen those muscles back there. Now, this is against gravity. Then as that gets easier, you can hold some weights. Let me show you on the band what that looks like. So I have some bands in my clinic. I'm sure you've seen these. They sell them all over Amazon. The magic is get the band, put a knot right in the middle, throw it inside the door, and then it's gonna be attached, right? Throw it inside the door, close the door. Sorry, forgot to say that. Close the door, and then it's gonna be attached. I got this fancy little thing here. Put the bands in your hand, give it a little light wrap, stand up nice and straight. Keep in mind your posture because you can do the exercises, but if you're not doing them right, it's not gonna help you, right? So if you're exercising and you're like this, that's not helpful, right? Think belly button into your spine, have a good base of support. Elbows are straight, thumbs are forward, elbows are straight, and when you pull back, you have to squeeze your shoulder blade. If you're not squeezing your shoulder blade, you're not doing it right. And I can't tell you how many times I work with my patients and nobody squeezes their shoulder blade. When you have an injury and you have pain like a shoulder impingement, it's so helpful to have someone next to you to give you what we call cueing. It's like, hey, pull in here, not up here. You're not pulling up here, you're pulling directly back, right? And so it's helpful to have someone next to you to kind of give you that guidance, because I can't tell you how many times I've done this exercise. And the thing is, everyone thinks it looks really easy, but doing it right is not that easy. And sometimes it's about the quality of how you're doing it. So I just want to encourage you, it's not that you're not doing it, you're not doing the right exercises. You're probably just not doing the exercises like as correctly as you could. So that's one of the things that I see, is that people don't squeeze their shoulder blade. And the other thing that I see is people are always bending them elbows, right? I'm telling you what I'm seeing. Like, I see it all the time. Therapists that I work with, who I train and teach, who I mentor on my online program, they get frustrated too, because they're doing the same exercises I'm telling you. But I'm telling you, form has a huge space when you're rehabbing something. Now, I know these exercises might look like, you know, just everyday exercises, but when you're exercising to just be strong, they're different than if you have a problem and you're exercising to rehab something, to fix a problem. So be mindful of your elbow. So a lot of times people will pull back and then straighten out their elbow. We don't want that. We want the elbow to be fully straight, and then there's a rhythm between this bone and the shoulder blade bone. So as you pull the humeral bone, as you pull your shoulder back, you want to then now squeeze your shoulder blades back and then come forward. So my thumbs are forward, my elbows are straight, and as I pull back, I squeeze my shoulder blades back and relax and pull it back. Pull, 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 squeeze, 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 and then I relax it slowly. The bands have a lot of traction to pull you back. So when you pull back and you let it go, you have to go slowly. You're not trying to release it really fast, because a rubber band, you have to act against the rubber band. So there's a difference between working with bands and also with weights that can play a really huge role in your recovery. So do impingement stretches work? Absolutely, they can work, but they only work very well when paired with strengthening types of exercises. And there's a gazillion that you can pick from. It just depends on what your capacity is and what you're capable of doing and what positions you can get into. So talk to your trusted therapist about this, and you're looking for someone who's going to watch not just a quantity of movement, but you're looking for someone who's going to look for the quality of movement. How well are you moving? What's the rhythm between these two bones in order to get rid of your impingement syndrome completely? All right, my name is Huang. I'm an occupational therapist and certified hand therapist here in Miami, Florida. If you are in Miami and you have a shoulder impingement types of problems, I'm gonna leave all my links below, and you can give my team a call and see how we can help you.